There we go.
Hey, Dr. Amy, how are you today?
I'm good, Dr. Sydney. How are you?
Doing good. I'm glad we're hopping on this call again. I guess this is our technical episode 2 of what we're calling Doc Talks right now, so very
hmm
exciting.
hmm
We were talking today, I'm getting a lot of questions from my patients about they feel a bit powerless right now, right? Like there's so many things going on and they want to, they're inundated with information and inundated with this feeling of wanting to make impactful changes in their health, but just getting into a place where they feel stagnant and frozen. And I think you and I have talked about what we call low-hanging fruit, right? Like
hmm
what is the low-hanging fruit? What is an action or an activity that we can take on today that's going to have the most impact? And what is your opinion about that?
Well, I think one good thing to look at is probably in terms of keeping our immune systems healthy, is probably to look at how much sugar we're consuming. And I know that a lot of people, including myself at times, have been doing some emotional eating, and sugar and refined carbohydrates are usually the food of choice when we're,
Culturally, right?
yeah,
Yeah.
yeah.
I always tell
And
my patients how we are our entire system is surrounded by sugar. Sometimes it feels like, right? Like every holiday, you got Valentine's Day,
Mhm,
you got your chocolates,
mhm,
St. Patrick's Day, you have your green beer, then we have Easter with our Easter eggs. And it's
mhm.
very interesting how that is ingrained in our culture. So of course it makes sense to me right now that that's a coping mechanism we're all going to.
Definitely a coping mechanism for sure. And, I think there's a lot of talk about, how to boost your immune system and and I kind of want to talk really quickly about what that means. You know what I mean? Because the immune system
Please.
is a very complex system, and it has multiple facets and levels and different ways of dealing with different inputs. So, but I think we do know at this point that the virus that's circulating does affect people who have diabetes more often. They have more severe disease, hypertension, cardiovascular disease. They
Right.
do have more severe disease. And we do know that diabetics really aren't faring well. And there's pretty solid evidence that when you're eating sugar and in a high glucose environment in the blood where there's high blood sugar, that immune cells do not work as effectively. We know that diabetics get more infections. We know that diabetics are more prone to having more microorganisms attach and getting different types of infections. So the question is, what do we do with that? In the face of this virus. And I think what we can do indirectly to help the immune system is to reduce our sugar intake.
Right. And I think that the thing that people don't always correlate is I'm always telling my patients to just be mindful of it, right? Like we've just acknowledged that sugar is our coping mechanism. We've just acknowledged that culturally we all have a different relationship with sugar. But I always encourage my patients to start feeling how they feel in their body. So if you have a bunch of ice cream the night before, do you wake up the next morning and do you feel a little bit more achy? Do you have more brain fog? Do you feel just a little bit more tired? So start correlating that, because as you were saying, it's how sugar interacts with our entire body, right? I think it's easy to
Yeah.
think that sugar is just another form of carbohydrate. It's a macronutrient. How could take eating a bunch of sugar actually affect my pain? And the
Mhm.
story I always talk about is one of the most difficult days in practice for me annually is the day after Halloween, because we all tend to have a little extra Snickers bar, little Butterfinger, our little mini of choice, right? And if I eat them in
Yeah.
mini form, it doesn't matter. It does, but that's okay. Uh, and so I'll be working on my patients and I'll start feeling their spine like I do. And I can feel increased puffiness. I can feel an increase, almost like a stagnation, if you will. And
Mhm.
once people start correlating, oh, this food that I'm putting in my body is actually having a physical effect on what's happening in my body, I think
Mhm.
that's when we can actually step back and start looking at how this is impacting us, so we have a better relationship with this rather than having it feel like something's getting taken away from us.
Exactly. I know I learned a long time ago One of the reasons why I started working on metabolic health in my clinic and making it as like very focused is because people's pain, I couldn't, my treatments weren't holding,
Right.
in people who had metabolic dysfunction, and which is a fancy way to say they were eating probably too much sugar.
Mm-hmm.
And it's so culturally endemic that it is something we're kind of working against. But I knew that I wasn't going to make much progress until I opened that door into metabolic health. And it's the same with the immune system.
Yeah.
Like, you can't make much progress if you have sugar floating around on a consistent basis. So, it's like, we want to manage our sugar intake. We don't want to have to, like, I'm not saying to like cut out sugar completely. And when I say sugar, I also mean like refined carbohydrates and palatable foods, right? And even some of these healthy whole grains. I do mean some of that too. But we want to think about reducing the frequency.
Exactly.
It's the frequency.
Reducing the amount, because as we've talked about before, it's the understanding of when every time I have sugar, my pancreas releases insulin, and that as a hormone is going to send off so many signals. So if
Mm-hmm.
I can just be mindful and reduce the amount of times that I'm eating sugar, thus reducing the amount of times that I'm triggering that insulin response, that in and of itself is going to have such a powerful impact. So it's just that mindfulness piece for people.
Exactly. And I think it's such a good sort of doorway in to just kind of think about, oh, maybe I could just reduce my carbohydrate or sugar frequency. And I have a really good strategy around that. It's just when you break your fast, when you have breakfast, I say break fast because a lot of people are doing intermittent fasting these days. They're not eating till 11 or 12 or 1, but
Mm-hmm.
whenever it is you do have breakfast, have a high protein or optimal protein, healthy fat breakfast to start your day, and have your carbohydrate intake or your sugar intake later on in the day, maybe in the
Exactly.
afternoon. So that's one strategy that's sort of easy and manageable
Yep.
for people. And people ask me a lot, well, does that include fruit? Do I have to skip my fruit for breakfast? And I'm like, yeah, if you can, or you just delay it for later.
Yeah, exactly. It's that
So
delaying piece, right? So I love talking to people about how we are actually the conductors of our physiology rather than being passive to it. Once you start learning these principles, is you
mhm,
actually get to look at your body as, okay, if I know that I can just delay my sugar for a couple hours, that in and of itself, just that powerful tool of, your breakfast, your breakfast, as you said, is high protein, high fat, and then you're having your carbohydrates in the middle of the day. That small step, right? That manageable step is so powerful, starting to give you more control in your body,
exactly. And you'll feel that control start to happen over time,
right?
because if you're not having sugar, oatmeal, milk for breakfast, whatever that sugar conduit is, right?
Right.
You're not going to get rebound hunger a few hours later like you would if you had a high sugar breakfast. So you're already setting up yourself metabolically. And then so over time you'll start to see it becomes easier, and that's where you're like kind of managing your physiology around it. And of course the emotional eating, right, is a little bit different
Yeah.
than the physiological cravings or hunger for refined carbs or
Right.
carbohydrate, sugar. So that's kind of a little bit of a different story, but um it's entirely possible. Like, I never thought that I could give up sugar ever, but one thing I kind of want to talk about too is that it is absolutely possible to reduce your frequency of sugar and or eventually even give it up for long periods of time.
Yeah, absolutely.
Yeah. So I don't know. I have basically like that, like optimal protein breakfast that could look like, you have to rethink breakfast a little bit. Maybe like you're eating maybe a ground patty, a turkey patty for breakfast with avocado. Maybe you're having a salmon fillet for breakfast.
Right. And
You're
it's that's that cultural thing, right? Like,
Yeah.
breakfast for me, when I started first making that shift, it's like I was very into, I have like my toast, peanut butter and jelly, a banana, and I would notice that I'd feel good for about the first 2 hours. And then after that, I would totally crash, right?
Yeah.
Versus if I just had, egg and avocado, all of a sudden I realized I had more sustained energy. And that, like you said, over time, you start changing the triggering of your physiology. So
Exactly.
you're actually not craving it so much, which actually is where we find empowerment in our health rather
Hmm.
than being a passive bystander. Because I know when that physiology starts to hit up against the emotional aspect, that's when that powerless feeling comes through.
Hmm.
And so that's why I think that's such an important tool, and the reframe of the idea that I'm in charge of my health. And I
Right.
think right now, with everything culturally that we're going through, if there is one place where you can feel that you can create a little power, a little control about what's happening, that's a wonderful place to start.
It's absolutely a wonderful, that's absolutely right. Because one thing people are feeling right now, I think we talked about this in our last episode, was, that feeling of fatigue and like, and just almost out of control feeling that we all have right now.
Hmm.
So to know that, okay, these doctors are telling me to give up sugar. Well, we're not really telling you to give up sugar. We're telling you that you have a choice here, and there are strategies you can use to get yourself to a different place where your immune system is going to function more optimally in an environment where we know we all need the best we can.
Yeah. And that's really the
So,
conversation that I feel is shifting with our patients right now, right? They don't,
yeah.
it's how do we build this resiliency? Because whether what's happening right, we don't know if what's happening right now is a new normal. We don't know how long this is going to last, but we do know that we have to build up our own resilience. And if you could build up your own resilience just by shifting how you eat one meal a day, isn't
Hmm.
that where that power piece comes in, where I feel like I have a little bit more control here, knowing that low hanging fruit, right? Like if I can just decrease my sugar even by 25%, oh, my inflammation is going to go down. So if my inflammation goes down, usually my pain goes down. If my pain goes down, then usually my cognitive ability increases. If my cognitive abilities increases, I might get more productive. If I can get more productive, I'm going to feel like I have more control in the situation.
Yeah.
I know in my life, I can link that all to the first changes that I started to make around breakfast, about not
Right.
having those sugar in influxes at breakfast. So I think
Absolutely.
that's the tool we're really just trying to give people.
I agree. And that the reason why people have sugar handling issues isn't necessarily because they ate sugar, it's the frequency at which they're
Exactly.
inputting.
Right.
Right. So we're just talking about reduction in frequency as the gateway into a more fine-tuned metabolism
Exactly.
and a better immunity. So and I think that idea really settles well for people, because you're not taking something necessarily away from them. You're
Right.
just giving them a strategy.
Exactly. And I think that when we talk about the cultural relationship that we have with sugar, which I think is the elephant in the room when it comes to this topic,
Hmm.
because sure, I mean, yeah, we all innately know I probably shouldn't polish off an entire container of Haagen-Dazs at night.
Right.
But there's a reason, there's a deeper reason why we do that. And I find that when you start, you can't tackle that all at once. You're not going to. But when
Right.
you start just, again, that analyzing the relationship with it, right, then you get to go and realize, you know what, if I have that, insert favorite sugar thing here, and I do that every day, I can correlate with how I feel, and then if I make a
Hmm.
small shift, I can actually have more control.
Exactly. I think it's all about the small shifts over time. I mean, some of us dive in, we do a full-on sugar detox. Okay, cool for you. That works for some people. That works for a lot of people. But there's also that idea of just small changes over time. Those micro
Absolutely.
goals that are more sustainable.
Yeah,
So I agree.
I think that's what we really facilitate with our patients.
Yes, that's
Amy, can you tell people where to get more information from you about all this?
yeah. So I'm at NorCal Integrative Medicine. My clinic is Northern California Center for Integrative Medicine, but the URL is norcalintegrativemedicine.com.
Gotcha.
You can contact me there through the contact page, and my number's on the website. How
And
about
you have
you?
a Facebook?
Oh, yes, I think it's Facebook Amy Schaus Wellness. I have
Nice.
to double check. I'll
Okay,
link to
awesome.
it in the YouTube.
Great.
How
And
about you, Sid?
we are at tamchiropractic.com. You can find us on Facebook under TAM Chiropractic, and also Instagram, TAM_chiropractic.
Great. Perfect.
Awesome.
All right. Talk to you soon.
Thanks, Amy.